Good morning. Under the Liberal government, we've seen a dramatic drop in public support for immigration in Canada. Before the Liberal government, Canada's immigration system welcomed people who came to Canada to work hard and to contribute. It protected the world's most vulnerable people. But the Liberals' decision to bring too many people into Canada too fast changed all of that. Canada did not have enough housing, healthcare capacity, or jobs to keep pace with the Liberals' mass immigration policies, but brought millions of people into Canada in a few short years anyway. And Canada's crumbling immigration consensus can be attributed to another Liberal failure too. To keep the system fair for everyone, we must end two-tiered Liberal policies that reward non-citizens with no legal reason to be in Canada at the expense of Canadian citizens and legitimate refugees. For example, the law is clear. Canada must deport non-citizens convicted of serious crimes. But the Liberals have allowed judges to sidestep the intent of that law, handing down lighter sentences precisely to help non-citizens avoid deportation. This makes our streets less safe for everyone. And failed asylum claimants, people who made refugee claims but had their claims invalidated through Canadian due process, are given access to better health care than Canadians. All anyone has to do is go to one of our ERs to see firsthand that our healthcare system is crumbling. More than 100,000 Canadians have died waiting for healthcare since 2018, which directly corresponds to the explosion of the cost of the Interim Federal Health Program. My colleague Dan Mazier will join me in a moment here. He's done an amazing job at the Health Committee uncovering a lot of the information that I'm about to speak about. To restore order and fairness, the government must end both of these practices. That's why today Conservatives are delivering constructive policy options to call upon the government to ensure that when foreign nationals are convicted of serious crimes in Canada, policies and practices must ensure that they leave, and restrict federal benefits received by rejected asylum claimants to emergency life-saving health care only. These are common sense measures that are needed to restore order and fairness to Canada's immigration and healthcare systems and to keep Canada working for everyone. I want to debunk some of the spin that the Liberals are using to defend the indefensible practice of giving failed asylum claimants better access to healthcare than Canadian taxpayers and providing two-tiered justice for non-citizens convicted of serious crimes. Let's start with healthcare benefits for failed asylum claimants. For starters, under the Liberals, the Interim Federal Health Program, the program that provides benefits to asylum claimants, has morphed well beyond its initial intent of providing care to a small number of legitimate refugees who are fleeing to Canada from war zones into a massive boondoggle that provides care to bogus asylum claimants. The cost of the program has ballooned too. Conservatives uncovered that under the Liberals, the overall cost of the Interim Federal Health Program has skyrocketed by over 1,000%, from $66 million to nearly $900 million a year, and it's projected to reach $1.5 billion a year. In fact, the Liberals have mismanaged the program so badly that they didn't give data to the Parliamentary Budget Officer on costs broken down by category. And right now, Liberals on the Health Committee are currently filibustering a motion that would ensure the government provides the PBO with this data. That's because, contrary to the Liberals' claims, Canada's asylum backlog has gotten worse. In fact, it hit a record 300,000 cases in December 2025, and massive numbers of people in that backlog will be found to have made bogus claims. This is no accident. It results directly from Liberal failures like lifting visa requirements on countries like Mexico with no safeguards to prevent bogus claims, and refusing to tighten border laws to stop illegal crossings and fraudulent asylum applications. Further, Conservative Order Paper Question number 556, for those of you who want to look at this, asked how many failed asylum claimants remain in Canada since 2020 alone. To give you a sense of the scope of the problem of the government giving health benefits to failed asylum claimants, the data in this order paper question showed that adding up the Refugee Protection Division and Refugee Appeal Division decisions shows that 86% of rejected claimants during this time period remain in Canada, or about 86,000 people. This aligns with recent government data showing that of at least 500,000 undocumented individuals in Canada, plus millions of people on expired or soon-to-expire work and other temporary permits, and thousands of failed asylum claimants, the Liberals oversaw the removal of only about 22,000 people last year. The government lacks both the operational capacity and the political will to accelerate deportations of non-citizens with no legal right to remain. So instead of removing them from Canada, they're providing better access to healthcare to failed asylum claimants than to Canadians. That is unfair, both to Canadians who have paid into the system their whole lives, as well as legitimate refugees. At a time when 6 million Canadians can't even find a family doctor and wait times to see a specialist have hit nearly 30 weeks, and nearly 24,000 Canadians died on wait lists in 2024-25, not a single non-citizen without a legal reason to be in Canada should receive better health care than Canadian citizens. Rejected asylum claimants should be removed from Canada instead. During the time that they are awaiting removal, which should be far faster than the pace the Liberals are currently on, their health benefits should be restricted to emergency life-saving care. Unfortunately, rather than ending the practice of giving failed asylum claimants better health care benefits than Canadian taxpayers have received, the Liberals are proposing to set up a costly bureaucracy that would still force Canadian taxpayers to foot the bill for 70% of the premium health care costs that failed asylum claimants incur. In fact, the Liberals have gotten things so backwards that they are cutting integration support, we found this out today, for legitimate refugees who want to contribute and be a part of our country, while they're providing healthcare benefits to failed asylum claimants. Instead, the Liberals should support our motion today, restore fairness, and restrict the health benefits that failed asylum claimants can receive to emergency life-saving care only. Our proposal to do this aligns with the Charter of Rights and Freedoms and our Constitution. Given the rapidly ballooning costs of the Interim Federal Health Program, it responds to pressing and substantial policy concerns. The 2012 changes to the Interim Federal Health Program were struck down primarily because they created tiers based on country of origin. Our motion today would apply to all failed asylum claimants. And the 2012 Federal Court of Appeal ruling explicitly rejected the argument that immigration status alone triggers protected equality rights, affirming distinctions between citizens and non-citizens are often permissible. Our policy today aligns with that ruling by applying equally to all failed claimants. Moreover, the Federal Court of Appeal overturned any notion of a Section 12 violation in this 2012 case, and the trial court also dismissed Section 7 arguments, confirming the Charter imposes no obligation to fund comprehensive health care for non-citizens. The Liberals have also claimed that non-citizens convicted of serious crimes do not get more lenient sentences in order to help them avoid deportation, but that is a blatant lie. Almost every week, another high-profile incident comes to light of a non-citizen convicted of serious crimes receiving a lenient sentence and avoiding deportation. In the last 3 months alone, we've seen many stories, including one which included a man convicted of child porn possession who knew it was a crime when he watched it, giving leniency as the judge gave him 6 months less a day, which the judge explicitly said was to avoid immigration consequences. This practice is perpetuating a two-tier justice system in Canada wherein non-citizens are treated differently than Canadian citizens. Having a two-tier justice system for non-citizens and a similar type of situation for health for failed asylum claimants is unfair and needs to stop. We call upon all parties to support our motion today, and my colleague Dan Mazier will talk a little bit more about the impact on Canada's healthcare system.
Thank you, Michelle. My name is Dan Mazier. I am the Conservative Shadow Minister for Health. For decades, the Liberal and NDP politicians have warned Canadians about the dangers of a two-tier healthcare system. This month, we learned that there is a two-tier healthcare system now in Canada. One tier for the people who've paid into this country their whole lives, and a better tier for those who haven't, including those who filed fake refugee claims. It's called the Interim Federal Health Program. This program was designed to provide health care to genuine refugees who were fleeing prosecution, but now it's being exploited by bogus asylum claimants. In 2016, the Liberals expanded the program to give supplemental health benefits to asylum seekers. According to the government, these deluxe health benefits include vision care, counseling, assisted devices, home visits, nursing homes, transportation, physiotherapy, occupational therapy, speech therapy, and translation services. These are not basic emergency services. These are deluxe health benefits that millions of Canadians pay out of the pocket or earn through their workplace. The minute someone files an asylum claim in Canada, they receive all these benefits automatically. But that's not the most troubling part. According to the Immigration Department's website, it states that this program covers individuals if their claim for refugee protection has been rejected by the Refugee Board. Rejected, not pending, not under review, rejected. Vision care, counseling, home care, physiotherapy, speech therapy, all of it. Meanwhile, Canadians who have paid into the healthcare system their entire lives are on wait lists. Genuine refugees also on these wait lists seeking the health care they deserve. But they are both waiting for the care in the same line as rejected asylum claimants that only add to the backlog and use the public resources. There were 100,000 Canadians who died waiting for health care since 2018. And because of a Conservative-led investigation at the Health Committee, the Parliamentary Budget Officer revealed that the cost of the Interim Federal Health Program will cost Canadians over $1.5 billion by the year 2030. That's up from $66 million a decade ago. Interim is supposed to be temporary, but there is nothing temporary about the Interim Federal Health Program anymore. It has become a permanent, expanding entitlement for those who was never designed to help. Thank you. And now I'll pass the mic over to Pierre Paul-Hus.
Merci. Merci, Dan. Bonjour tout le monde. Une chose est claire, les libéraux ont brisé le système d'immigration. Ils ont tellement négligé le système que les Québécois et les Canadiens ont perdu toute confiance envers notre système d'immigration. Le consensus québécois et canadien sur l'immigration est brisé. L'immigration qui était autrefois une réussite dans notre pays est maintenant un échec libéral. Depuis que les libéraux sont au pouvoir, les seuils d'immigration ont explosé. Au Québec, il y a maintenant environ 600 000 résidents non permanents, dont un peu moins de 200 000 demandeurs d'asile. On se souvient encore des libéraux qui ont négligé la crise d'immigrants au chemin Roxham, une crise créée de toutes pièces par Justin Trudeau. Tout ce monde-là, en trop grand nombre, ça met de la pression sur notre système. Ça met de la pression sur la crise du logement dans toutes les régions du Québec. Ça met de la pression sur notre système d'éducation également. Pour que notre système d'immigration continue de bien fonctionner, nous pensons qu'il faut mettre fin à l'injustice mise en place par les libéraux. Un système injuste qui privilégie les faux demandeurs d'asile, pendant que 6 millions de Canadiens ne sont même pas capables d'avoir accès à un médecin de famille. Bientôt, comme l'a décrit le directeur parlementaire du budget le 12 février dernier, les contribuables québécois et canadiens vont devoir payer jusqu'à 1,5 milliard de dollars pour payer les soins de santé des faux demandeurs d'asile. C'est pour ça que nous déposons une motion pour demander des changements au programme fédéral de santé intérimaire. Pour s'assurer que les Canadiens puissent avoir accès à des soins de santé, pour s'assurer que les faux demandeurs d'asile n'aient pas de services que les gens ordinaires au quotidien n'ont même pas accès. Dans notre motion aujourd'hui, on demande de revoir les prestations fédérales accordées aux demandeurs d'asile en vertu du programme fédéral de santé intérimaire, de limiter les prestations fédérales accordées aux demandeurs d'asile refusés seulement pour les soins d'urgence urgents et vitaux, d'assurer plus de transparence pour les dépenses fédérales du programme fédéral de santé intérimaire avec un rapport annuel déposé au Parlement, d'adopter des politiques pour expulser plus rapidement les ressortissants étrangers reconnus coupables de crimes au Canada. Pour nous, ce sont des mesures qui vont permettre de rétablir le consensus québécois et canadien en immigration. Parce que pour nous, aucun citoyen sans droit légal de rester au Canada ne devrait recevoir de meilleurs soins de santé que les Québécois et les Canadiens. Merci.
Do you support the immigration? This is for MP Rempel Garner. Have you had a chance to take a look at the 5 immigration-related questions that are going to be put forward to you and your fellow Albertans in October? And do you think that things like a 12-month residency requirement for certain social services and a national proof of citizenship law for voting, do you think these are things, items that we should put up for discussion at a national level?
Well, as both an Alberta Member of Parliament, but as the Conservative Shadow Minister for Immigration, I want to, direct the answer to that to the Liberal government. Over the last decade, we've seen the Liberal government bring too many people in too fast for housing, healthcare, and jobs to keep up, and that, of course, has had pressure on provincial government services. It's not just Premier Smith who's talking about the impact that failed Liberal immigration policies at the federal level have had on provincial governments. I remember a time not that long ago when Toronto Mayor Olivia Chow suggested that she might have to raise property taxes because of the influx of, essentially failed asylum claimants that were coming into the city. This is why Conservatives, including myself, have been putting forward common sense solutions to restore order and fairness to the federal immigration system so that, provincial governments who have really borne the cost of a lot of these failures can see a light beyond the current disarray that they already have. I would just say this, my colleague Dan, he had the immigration minister at the health committee, and she admitted full on that the Liberal government doesn't consider the impact on provincial health care costs when setting their absurdly high immigration targets or failing to remove millions of people who are on expired or expiring visas. So the question really is for Mark Carney. Will he accept common sense Conservative proposals that are put forward in good faith to restore order and fairness to the immigration system, or will he continue to force provinces to have these types of discussions?
Just on the program, the Interim Federal Health Program, do you have any idea how much of this additional cost is related directly to asylum seekers whose claim has been rejected?
Yes. So this is why I put the order paper question in my remarks. So we did have an order paper question that showed the amount of failed asylum claimants that haven't been removed from Canada since 2020. So it was about 86% of those persons have not been removed, and it's somewhere in the neighborhood of 80,000+ people. So that's a lot of people that are receiving benefits for years, right? Beyond that, we know that the cost of the health program, or the Interim Federal Health Program, has increased from $66 million in 2015 to over $1 billion this year alone. It's projected to continue increasing. We've also asked the parliamentary budget. There's a motion in front of Health Committee right now for the government to compel the government to give more data to the parliamentary budget officer to break it down into more prescriptive categories. But it doesn't take a mathematician to look at the emergency room lineups across the country and understand that when you're putting 100,000, 300,000, whatever more people into those queues, that there's going to be both a cost and an impact to wait times. So what we're saying is this. This program was originally designed to give emergency care to a small number of refugees who were fleeing war zones. It is now mushroomed well beyond the case, and because there's such a ballooning of failed asylum claimants, and frankly also, we just know by statistics, of the 300,000 that are pending right now, a big chunk of those are going to be found to be bogus, just by statistics in the past. It makes sense for the government to restrict healthcare benefits for failed asylum claimants to emergency life-saving care only, and ensure that people who don't have a legal reason to be in Canada, as prescribed by the law, which has been in place by decades, are removed.
The government's been pointing to Bill C-12 as a way to get asylum levels back under control. Minister Diab telling the committee a couple of weeks ago about 37% of applications between June and the end of October from last year would just be wiped out by this one-year ineligibility measure. Why is that not enough to cut
Well, the backlog is at 300,000. So think about a city the size of 300,000 people. And we know that those claims will not be processed for many years. During that period of time, everybody that's in that backlog can claim all sorts of different benefits. We saw over $1 billion spent on hotel rooms for asylum claimants. So that's problem number one. Problem number two is what we're talking about today, is that this also has an impact on the healthcare system. So the backlog itself, even beyond the measures of what are in C-12, which we've supported, are continuing to grow. It's why I was out here 2 weeks ago talking about the need for the Liberal government to put in place more border restrictions to stop the influx of illegal border crossers that we're saying in response to certain policies that have been put in place south of the border, right? So I really think that in order for us to decrease the pull or the incentives to abuse the asylum system, we have to take away some of the incentives that are making that happen, including people know that even if their asylum claims, or they're making a fake claim, that it's rejected, they're not going to be removed for many years, and during that period of time, they can claim better healthcare benefits than Canadians have. If that goes away, we restore order and fairness for everyone, including legitimate refugees, and we also ensure that there's less incentives to abuse the system. So why is it not enough? Because the Liberals haven't addressed the incentives to abuse the system, period. And we need to move on that as well.
The Liberals introduced, I believe, a co-payment system in the budget with this program. Are you confident at all that that will bring some of the costs down of this overall program?
So as I said in my remarks, what the Liberals are doing is instead of ending health benefits that are better than many Canadians receive for failed asylum claimants, this is what they're doing. They're implementing a costly bureaucracy in which 70% of that cost would still be borne by Canadian taxpayers, okay? And then somehow a government that has failed to even get pandemic scam stuff returned to them is expecting failed refugees on deportation orders, many of whom derive their income from social welfare, to pay back the costs. That doesn't sound like the most optimal outcome. What sounds like the most optimal outcome is saying, look, let's reserve health benefits for legitimate refugees, for Canadians who have paid into the system, and people who have failed asylum claims, as per the law says, need to leave Canada as opposed to getting into an emergency room line.
You cited lack of operational capacity in the problems with failed refugees staying in country. Can you just unpack a little bit about what you mean by that?
Well, the Liberals get up in the House of Commons and say they've removed 22,000 people last year. Well, there are millions of people in Canada who have expired or expiring visas. There's 500,000 at least undocumented persons and, close to 100,000 failed asylum claimants in Canada right now. So millions minus 22,000 is still millions. So clearly there are some operational challenges there, putting it mildly. And I actually find it flabbergasting that the Liberals are coming forward and saying, oh, well, we removed 22,000 people when there's millions. We need to reduce the incentives to abuse the system. We need to restore order so that the immigration system benefits the people it was supposed to benefit. People who want to come here, as millions of immigrants have done, play by the rules and contribute. This is how we restore the immigration consensus in Canada, and we have not seen anything from the Liberals to date on this.
You speak about common sense. En français?
Quel genre d'opérations ou de ressources supplémentaires sont nécessaires que le gouvernement doit mettre en place pour expulser les milliers de personnes dont la demande d'asile est refusée ou dont le visa est expiré? Je pense que...
le travail revient à l'Agence des services frontaliers du Canada, qui a le mandat de trouver ces personnes-là. Et premièrement, les gens reçoivent un avis, mais souvent, il y en a plusieurs qui ne tiennent pas compte de l'avis d'expulsion. Donc, c'est à l'Agence des services frontaliers de les trouver et de leur faire savoir qu'ils doivent quitter le pays. Ça prend des ressources supplémentaires, évidemment, mais surtout, ça prend une volonté politique de le faire. Actuellement, ce qu'on voit, c'est qu'il y a plusieurs personnes sur le territoire, des centaines de milliers de personnes sur le territoire qui sont dans des statuts plus ou moins clairs, dont des demandeurs d'asile refusés. Ces gens-là qui bénéficient du système de santé actuellement ne devraient même pas être au pays. Donc, l'Agence de services frontaliers doit faire son travail. La coordination se fait évidemment entre l'immigration et l'Agence de services frontaliers. On en a souvent des cas dans les bureaux de comté, des gens même qui viennent nous voir, qui ont un avis d'expulsion, qui nous demandent de l'aide. C'est parce que quand il y a un avis d'expulsion, c'est parce que le dossier a été traité et ce que la personne devrait faire, c'est de quitter tout simplement. Mais ça, effectivement, ça prend une volonté politique du gouvernement et mettre les ressources avec l'Agence des services frontaliers du Canada. Merci.